People with RA have a higher risk of heart problems. In fact, studies show that RA increase the risk of developing heart disease by 1.5 to 2 times compared to those without the condition. That's almost the same level of risk as diabetes, which is pretty serious. But what exactly is going on here? Why does RA affect the heart? Hello everyone, this is Dr. Siddharth Tambar from Chicago Arthritis and Regenerative Medicine. Today I want to talk to you about something very important, how rheumatoid arthritis or RA can affect your heart and overall cardiovascular health. Rheumatoid arthritis is not just a condition that affects your joints, it can actually impact your heart as well. And it's crucial to understand this connection, especially if you or someone you know is living with rheumatoid arthritis. The main reason RA impacts your heart is inflammation. Rheumatoid arthritis is an inflammatory disease, and when your body is constantly inflamed, it doesn't just affect your joints. It affects other parts of your body as well, including your blood vessels and heart. Inflammation can damage your blood vessels over time. This damage can cause plaque to build up inside the arteries, narrowing them and making it harder for blood to flow. And when blood can't flow properly, you're at a higher risk of having a heart attack or stroke. Let me explain it this way. Think of your blood vessels like a smooth highway. Normally cars, or in this case your blood, flow easily. But if there's construction, potholes, or debris on the road, traffic slows down and accidents are more likely to happen. That's similar to what happens when inflammation affects your blood vessels. This process can lead to something called atherosclerosis, which is a hardening or narrowing of the arteries. Over time, this can cause major heart problems. Another important factor is cytokines. These are proteins in your body that help to regulate immune responses. In people with RA, cytokines are overactive. This overactivity not only damages your joints, but also harms your heart. When cytokines act and attack on blood vessels, it contributes to cardiovascular disease. People with RA also face specific heart complications. For example, they're twice as likely to develop heart failure compared to people without RA. Interestingly, RA patients with heart failure often have something called preserved ejection fraction, meaning their heart pumps well, but the problem lies in the heart's ability to relax and fill with blood. That's called diastolic dysfunction. This type of heart failure is linked to systemic inflammation, meaning inflammation throughout the body, not just in the joints. Now let's talk about vascular disease. While RA's effect on non-cardiac vascular disease, like issues with blood flow to your legs or brain, isn't as clear, some studies suggest that RA patients have a higher risk of things like strokes and blood clots. They may also be 2 to 3 times more likely to develop venous thromboembolism, which is a type of blood clot that can be dangerous. One more thing, RA changes your cardiovascular risk profile. People with RA tend to have higher rates of smoking and other factors that make heart problems more likely. Their cholesterol levels are also affected in unusual ways. During flare-ups of inflammation, both bad LDL cholesterol and good HDL cholesterol levels drop. The problem is that the good cholesterol drops more, which can lead to a less healthy cholesterol balance. So what can be done about this? First, it's important for RA patients to understand that managing their cardiovascular health is just as important as managing their RA. You should regularly get your heart checked, including cholesterol and blood pressure screening. Unfortunately, RA patients are often undertreated when it comes to heart care. For example, chest pain in someone with RA might be mistaken for joint pain, delaying a heart disease diagnosis. To protect your heart if you have RA, here are a few things you can do. Stay on top of your RA treatment. Keeping inflammation under control is key here. This will not only help your joints, but also reduce your risk of heart disease. Exercise regularly. Gentle, low-impact activities like walking, swimming, or biking can improve both joint and heart health. Quit smoking if you smoke. Smoking is a major risk factor for both RA and heart disease, and quitting is one of the best things you can do for your health. And monitor your heart health. Get regular heart checkups and discuss any concerns with your doctor. In conclusion, rheumatoid arthritis affects much more than just your joints. The chronic inflammation seen in RA can lead to serious cardiovascular problems. But by managing your RA and taking care of your heart health, you can lower your risks. If you have RA or suspect you do, talk to your doctor about how to keep both your joints and heart in good shape. Thanks for watching. If you found this video helpful, please like and share it with others who might benefit from the information. And as always, if you have any questions or need more information, feel free to reach out to us at Chicago Arthritis. Until we connect again, take care, stay well, and live well. Bye-bye.